I do remember in the sort of research for my Don's paper, coming across a case where somebody in the US was injected with bathtub silicone.
Oh, gee.
And they actually died.
What about DIY injectors? So we've spoken about people that go to practitioners who aren't trained, but you do see people that think, you know what, this looks pretty easy. Just gonna do my own. So I mean, do you see those sort of DIY people? I mean, it's not like putting down, I don't know. It's not like, I don't know, putting a cabinet together from IKEA or putting something. It made sense. So, I mean, what's your experience with that? And are you sort of seeing same kind of things happening with people deciding to have a crack at their own treatments?
Do you know, I have not personally seen someone self-inject and have an issue. I'm sure it happens. I'm confident it happens, but I personally have not seen anyone. And and unfortunately, that kind of reinforces my earlier point that I think it is something that people will often get away with it, which I think is one of the reasons why the issue is so unchecked.
I guess you're probably more likely to make sure your product's legitimate if you're putting it in your own face.
Exactly.
Yeah.
Although I do remember in the sort of research for my Don's paper, coming across a case where somebody in the US was injected with bathtub silicone.
Oh, gee.
And they actually died. They didn't self-administer that, but
Wow.
people can be quite adventurous in terms of what they'll install. But yeah, self-injection, I believe, is a problem, and I think that it really does. I don't know what you do with people who self-inject, because to my mind, anyone who injects themselves is not very clever. And unfortunately, there are professionals who will inject themselves, and it may well be that they think that that's okay in certain circumstances, but I personally don't agree with that.
What do you do if you get if you get like an occlusion? You're going to start. I mean,
you self-inject your highlights. No, but
wow.
Joke, by the way. Now,
Exactly.
I guess some summary points. So if we've got any consumers or patients listening, what would your advice to be? I guess this is UK specific. You can only speak for the UK about how to find a reputable injector.
There is no regulation per se for reputable injectors. I think it does require a little bit of detective work to try and, assess people, see what their reviews have been like, check out their websites, maybe try and see if there's opinions from somewhere else. But Save Face, the group that I mentioned earlier, there is a Save Face register, and they will assess people and check them out. And I know of some clinics in Scotland who are also Save Face registered. It doesn't mean you're a good injector. It doesn't, there is no way of establishing that you are in fact good. Personally, I'm not on the Safe Face register because I'm already regulated by the Scottish regulator. But in England and Wales, Northern Ireland, I guess that would offer a little bit of comfort. But other than that, there is no real way other than checking reviews, going along for a consultation. And what I always work on the basis that someone comes to see me, it's a consultation. We are not by default doing a treatment. It's a case of we have an assessment, and if they choose to hit the go button, and depending what the treatment is, when that would happen in terms of a timeline, then that's fine. But I think from a patient approach, they should have a healthy amount of skepticism, recognize that the industry is pretty unregulated, and go in with their eyes open. And I think if they do that, they're going to be as safe as they're likely to get.
Yeah, I think it's the same advice here, to be completely honest. And of course, if you're going to see a doctor, dentist, nurse, here we would have the ARPA register. You've got the GMC register. Make sure they're actually a licensed persons and they are who they say they are. Going back to what you said about those people masquerading as nurses and doctors. I mean, surely that's a crime. That's
it is.
A crime.
Yeah. That is a crime. Yeah. And again, we don't really get to see what happens in those situations. It's not very well publicized, but absolutely, it is a crime. And the hope is that the law is actually applied and that these people get the punishment that they deserve.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.